Right, so welcome everyone to our initial Merseyside Health podcast. I'm really delighted today to have Dr Carl Bescoby with us today. He's a rehabilitation psychologist and really interesting guy. I've been following his work on Instagram now for quite some time, and so Carl, I'm really grateful for you for coming on the podcast today. So, would you mind giving us a little bit of an introduction about yourself, please?
Yeah, thanks, Ben, and thanks for the kind words. So as Ben said, I'm a rehabilitation psychologist. I support the kind of mental side and emotional side of anyone rehabilitating. So anyone going through injury, illness, chronic pain or persistent pain, working on kind of managing those recovery journeys, but kind of away from the physical side, more on the mental side. So I guess it's probably quite unusual to what people think when they think about rehabilitation, but essentially it's trying to embed some psychological tools and support to help manage that trajectory for individuals. So my background is actually in sport, so I trained as a sport and exercise psychologist and specialized very early on in my training in injury recovery. So I was really interested in supporting injured athletes, dancers, performers with their kind of rehabilitation needs. And that took me on a journey through sport, through chronic illness, and through persistent pain. So I work across all of those areas now at the moment. So working with people with persistent pain, working with injured athletes and injured dancers. And yeah, I think it's a fascinating area, but quite a complex one that kind of very much stems between the physical and psychological. So I work with a lot of people like yourself to try and bridge that gap and to enhance and kind of enable a more holistic way of managing recovery than perhaps we're used to. So I don't know if that makes sense or not.
Super. So how did you get into the dancing then? Because that's for me as a physio, I've worked with some dancers and some performers over the years, and I've always found them to be a very interesting and challenging sort of group to work with, because there does always seem to be a high pressure environment and a psychological element to injuries in that group. So I'd be interested to hear how you got into that.
Yeah, absolutely. So it is a really interesting group, and I initially got approached through my Instagram by a dance school and asked if I could come and support their injured dancers with the kind of psychological side of their rehab. As you said, their environment of dance is a fascinating one with a lot of intricacies and individual, quite unique challenges, things around weight management, kind of training and training intensities. Certainly kind of created quite a complex interplay between how individuals would manage and navigate injury. So yeah, I came on board and about 2 years ago started working with various dance schools, both on the education side to help dancers educate around how to look after themselves when injured psychologically, informing their mental health and their well-being, but also on a one-to-one basis, trying to support their individual trajectories back to performance. So it is a complex and fascinating kind of discipline, one with a lot of their own unique challenges, but also a lot of similarities with kind of high performance environments and sport as well, when it comes to kind of injury rates and kind of the mental side of rehabilitation.
Yeah, and you mentioned there the sort of the weight management, because that's the big one with the dancers, isn't it? It's particularly your female athlete dancers, and they've got a lot of pressure to try and keep at certain body weights, and that then has impacts on their ability to recover from an injury when they've got these sort of relative energy deficit conditions in the background. So we've obviously sort of brought you into our team a little bit as our sort of resident psychologist to help us out with cases, and when we sort of realize as physios, hang on a minute, we're not psychologists, we need to bring in a professional. And do you work with dietitians, and how does that work in the dance schools?
Yeah, so I guess in terms of collaborating with other clinicians, certainly my involvement in dance has been very much kind of an MDT approach with nutritionists, with physios, and other mental health support providers as well, to kind of enable rehabilitation to the best ability, whilst also thinking about well-being, both physical and mental. So yeah, there is a kind of holistic approach to it, and certainly my remit has been on the kind of psychological side of injury and rehabilitation, rather than kind of weight management. But we would work with counsellors or clinical psychologists or other nutritionists or other clinicians adept with focusing on those areas, or specialised in those areas, to really truly support individuals, because it is a challenge, right? And for a lot of individuals, they may, especially kind of sports or areas of performance that are kind of weight bearing, may then adopt unhealthy behaviours as a way of coping with their injury or their setback. If they're unable to dance for a certain amount of time, then they might kind of restrict diet as a way of compensating for their lack of activity or performance. So then there becomes kind of challenges around rehabilitation, getting the right nutrition in, but also some unhealthy coping mechanisms there that can start to develop. So it's important to bear that in mind going into any kind of setting or environment like that.
Yeah. So, and I suppose a lot of people listening, there might be some psychologists listening, but I think probably there'll be quite a few physios and maybe coaches. And so can you give us a bit of an insight into what once you get into a room one-on-one with a psychologist, what's the sort of, how's that interaction working? Is it like we see on the television, someone lying down on the couch, or how do you sort of structure that, or is there not really a kind of a formula?
Yeah, it is very variable, dependent on the individual, but also the practitioner. For myself, I would not get people to lie down on the chaise longue and close their eyes and talk about their feelings.
Really
yeah,
but
it would be very conversational, like what we're doing now, and it would be trying to really understand the mechanisms behind what they're dealing with. So it usually starts with a kind of psychological assessment, very much like a physical assessment, really kind of understanding what's going on mentally, emotionally, psychologically. But it would be practically involved in kind of behavior change or implementing certain strategies, whether that's to manage stress, motivation, fear, anxiety, or general kind of emotion management. So there's a lot of kind of practical strategies and skills that get implemented along the way. But I'd first start off with having a conversation, finding that kind of human part of everyone to interact on that level first, and really make people feel comfortable to be able to open up and share some of their challenges. And for some, with their complex injury trajectories or pain or illness or disability, that can be quite difficult to get to that place. So I would probably take more of a softer approach, and my style is very much kind of compassion first, human first approach. But yeah, it is very conversational, so you'd probably be quite different from, I guess, your approach, Ben.
What was my just beasting people around the gym all day type of approach?
Yeah,
absolutely. Well, it's interesting. So one of the things that sort of attracted me to work with you initially is that I think I've read a post, or I can't remember if it was in your bio, when I was kind of going through the internet looking for sort of psychologists and things like that, and one of your comments was, and correct me if I'm wrong here, but you said something along the lines of, I'm not trying to change the way you feel, I'm trying to help you understand and make sense of it to move so that you can, move forward. And I thought, yeah, that is the often some of the complex rehabilitation cases that we have. We can't always completely fix somebody. We try as far as we can, but at the end of the day, effective rehabilitation is about helping people to move forward with their life and understand how their body now works and make the best of it. So I thought that was quite a good fit for us, really. Is that sort of common for psychologists, or is good psychological practice like that across the board, or have we got people trying to change how people think all the time?
I think there would be it would be really varied. So some psychologists might be more inclined to want to change behavior or change unhealthy coping strategies or styles. But yeah, I guess for me, exactly like you said, I feel that kind of people are already going through substantial change, whether they're injured, ill, or dealing with severe setbacks. And I just feel like I can assist in helping people to positively adjust and grow through those experiences, rather than feel like I have to change them as a consequence of what they've been through or going through. And I really believe that individuals have the capacity within them, have the tools within them. It's just about connecting them to the right path at the right time. So yeah, I don't feel like individuals need to change, but more the relationship with those events can be adjusted slightly so that they feel more equipped to navigate what they're going through. So yeah, it is very much trying to foster that resilience, that kind of self-efficacy, that sense of empowerment through rehabilitation. And yeah, I really feel like everyone has the ability to adapt to overcome the challenges. They just need to believe in it firstly. So I guess that's where my philosophy sits.
Yeah, when I read that, it reminded me of some years ago. I was doing some motivational interview, a group of physios. We got, we're lucky enough to go on a course where we're being taught motivational interviewing techniques, and I was absolutely terrible at it because I kept wanting to give solutions. You should do this, you should try this, and that course was a real eye opener. And I always say, I'm not a psychologist, and then try and give some advice. And I've been practicing trying to step away from that more and more, because I think that is an unhealthy physio habit. We've got this thing of, we're going to fix you, we're going to fix this, and obviously that's what we want to do, and the patient wants us to do that. But sometimes giving solutions repetitively, it can be a really negative consultation experience for patients, can't it?
It's really tough because, like you say, there's this innate desire to want to help people, and we feel like the way in which we can do that is by sharing some solutions and try and get people to be less unstuck or less in pain, or really fix what's going on for them. And I get that, and it's a natural inclination to want to do, but sometimes the best solutions that you can offer someone aren't going to be put in place unless it comes from within sometimes. So it's trying to get them to connect the dots themselves internally to see those solutions, to then be able to put them in place. So sometimes I feel like I have to bite my tongue and not suggest those things that I feel might benefit someone, but really just try and help them to see what they think those solutions are, and get them to take steps towards that. That way you're promoting that autonomy, and people are more to follow.
Often when I found that I've bitten my tongue and just held on a little bit longer, they will often volunteer a certain information, such as, oh, I know I ought to change this. And then I think, oh, thank goodness I didn't say that. because they already knew that and felt that. And if I'd said that on top, it would have just been another healthcare practitioner saying, you really need to lose some weight, or you really need to, or you should really give up smoking, and that might help you with X, Y, and Z. And sometimes that's just not helpful at all, or conducive to a good consultation, is it?
No, and often I think people know what the solutions are. They know what they need to do, but there's a kind of complex interplay of beliefs or certain feelings that come up which maybe prevent them from taking those solutions, or following through with that behavior. So it's kind of understanding that, in which I think is more important than just kind of offering those solutions. But of course, there's times where solutions are important, and I think the way I move towards that is just by questioning. And I think a question can really unlock and change the way people view a situation. And if you ask a more solution-focused question, it can really transform the way someone looks at a problem or a situation. So, yeah, I really do feel like people have those solutions, but they just need prompting every now and then.
One of the therapists who I read quite a few of his books, and he's I think he's probably passed away now, but I don't know if you've ever heard of him. He was an engineer, and his name, I think, was Moshe Feldenkrais. I don't know if you've ever heard of him.
Yeah.
You cross him. He's big in dance and performance arts, isn't he? And I think he's probably passed away now, but one of his quotes, which I really like, and I need to put it up on the wall of my clinic one day, is, you've probably heard it, you're smiling, so you probably know which one I'm going to say. I think it is, I'm not looking to achieve flexible bodies, I'm looking to achieve flexible minds to help restore people to their human dignity, or something like that. And I think that is a really good one. If you can keep that in the back of your mind and help people have a flexible way of seeing things, they often come out of their stuck behavior and are able to move themselves forward. Have you heard that?
Yeah.
You're nodding away.
Yeah, and it just.
You've got it up on your wall, haven't you?
I would like to. I think it's such a good quote, and it really kind of lends itself nicely to my philosophy, which is centered around something called acceptance and commitment therapy, which its main premise is to facilitate psychological flexibility. So it's absolutely situates right in there really nicely. And you're right, it's flexible bodies, but flexible brains, flexible minds that can really help establish ways of moving forward and being unstuck. So yeah.
Well, there you go. That's your Christmas present sorted, isn't it? A framed Christ quote.
Exactly. Yeah.
Right. Can we talk a little bit about emotion then? Because one of the underlying things that we haven't mentioned, which I said we would straight away, and I haven't, terrible host, is that you're coming up to Liverpool to deliver a training day, and that's going to be in Liverpool Hope University on Tuesday, the 24th of April. I'm sure I've got that correct. I'm double checking it now.
That sounds.
Tuesday, the 23rd of April.
23rd, that's the one. Yeah.
Don't come on the 24th. Of anyone listening to this, come on the 23rd, and that's at Liverpool Hope University. And you're going to be doing, what's the full title of what's the sort of full topic of the course?
Yeah, so it's titled Emotion Management in Physiotherapy. So it's really kind of understanding and addressing the emotional dimensions of injury and rehabilitation. Now that sounds a bit of a mouthful, but ideally it's for physios, clinicians that are looking to really deepen their understanding of the emotional aspects of rehab, and in doing that enhance client outcomes and create a practice or create practices that prioritize both their own and practitioner well-being. And I think that's important because often when we think of emotion management or holding space for patients, clients' emotions, it comes with sometimes this heaviness in holding on to that, and kind of carrying those kind of interactions. So I think a way in which we can address those, but also focus on protecting self and looking after your own well-being is a real key priority. And I think as a psychologist over the past 10 years, I've learned ways in which to do that so that I can keep this career going in a meaningful and positive way. So yeah, I think what I really want to do is just help people to understand the emotional challenges that individuals are going through when injured. And I know for a lot of physios, they will understand the emotions, will understand kind of what their clients, what their patients are faced with. But then it's just kind of exploring strategies to enhance what we call emotional agility, that kind of flexibility we touched on, just how to adapt and how to build that resilience. So it's really practically focused around tools that physios can implement when working with their clients or patients, in a way to navigate that emotional roller coaster with rehabilitation. And we know through evidence that if we manage those emotions effectively, it can positively influence recovery in terms of adherence rates, and commitment and autonomy to rehab programs. So yeah, there's some important and interesting emotional strategies that we're going to integrate, and look to integrate in a very practical way during that day. So if this sounds interesting, come along.
Yeah, you can book yourself a place on that via Eventbrite, just typing in physiotherapy and Liverpool, and I think it's on the top of the list there. So there's an early bird offer on that until the end of March, and then so snap those tickets up. It's going to be really good. I'm really looking forward to it. I've sort of done some work into the pain management. And I think when you sign up for pain management type clinics, you know that you're going to be dealing with emotion, and you know that you're kind of ready for that. Because I'm now in sort of more sports injuries and musculoskeletal practice and that type of thing, I think sometimes you have to look out for those emotional cues, perhaps when they're maybe not so obvious. And if you would agree with that, but that recognition of when there's an emotional component that may be holding back the rehabilitation, the optimum rehabilitation of a person is that's what I'm really looking forward to anyway. Maybe improving my hard wooden emotional range, my emotional intelligence. My wife would definitely say that needs to be included in the course. You need to improve Ben's emotional intelligence, please, Carl.
I'll put that as one of the course objectives. Yeah.
Yeah.
But yeah, you're absolutely right. I think there's certain kind of emotional barriers that maybe get in the way of rehab, and some of these can be quite subtle. Things like fear of re-injury or kind of lower self-esteem or anxiety. They can hinder progress and really get in the way. So it's just kind of looking and kind of picking up on how to address those emotions, and some of the softer skills like empathy, active listening, can really help with just offering some space for individuals to share their emotions. And we know through evidence that even just speaking out emotions can be significantly beneficial to those going through rehab or looking to return. So validating, acknowledging emotions, it also kind of creates a supportive environment where individuals feel seen, heard, accepted. And they're really softer skills that are actually really, really important, and it can build that sense of trust.
They're really fun, aren't they? They're soft skills, but they're actually incredibly difficult to do day in, day out, a full list of clients, to keep those small details in the consultations ticking over and appropriate. is a challenging. I don't think they should be called soft skills. They should definitely be called incredibly difficult skills.
Yeah, and
So
it's interesting because what I find is that physios are, you know, center of rehabilitation for individuals and for athletes, for anyone that's going through significant rehabilitation. They are the kind of go-to, and I think there's an opportunity there just to really inform those environments with a bit of psychology, with a bit of emotional agility, things that can just help physios enhance their delivery of what they're doing, or psychologically inform their delivery in certain ways. And I think physios are often the first people that individuals kind of disclose their challenges to, because they're already kind of broken down that barrier of engagement. So yeah, I really want to just give those learnings to physios and clinicians to go out and feel confident and comfortable to be able to kind of, you know, teach their clients or patients those coping strategies or regulation skills that are going to help them manage that emotional side of their journey, or manage that stress or anxiety or pain flare up more effectively. So yeah, I really hope that there will be some practical tools that can add to your armory of tools that you're already using.
Definitely. I think it's interesting because whenever you run physiotherapy courses, and there's the same old sorts of things, you know, taping and manipulation and massage, and historically they've always done very well. But I do think now more physios are looking at their psychological skill set, and it's just that careful balance of understanding that we're not psychologists, but at the end of our title is we get shortened to physio, but we are physiotherapists.
Yeah.
And absolutely, you know, unbelievable strength and conditioning coaching and all that sort of stuff. But where injury is involved and where a rehabilitation journey is involved, exercise plus that psychological awareness and that informed psychological practice, that's what makes it therapy. Because if you just turn the sound off and watch the session, it might look exactly the same as a personal training session. But those little conversations and those little bits of reassurance and validation, that's what builds a rehabilitation journey, is what I'm starting to understand more and more, really.
Absolutely. And I think it's so refreshing hearing you speak like that, because I feel quite empowered to think that physios can really hold space in that way. And I want to really enhance their confidence and feeling like they can, you know, and not thinking like, oh, this is mental health, or this is emotion, or this is psychology. I don't want to approach that. I really want individuals to feel that they can hold that space with their clients or patients, because I think, yeah, the more support that is kind of holistically focused, the better the outcomes are going to be.
Yeah, superb. Well, Carl, I think we've kind of we set ourselves a target, didn't we, of not going on and chatting forever and ever. So I think we've done a good job there of covering some key topics. Is there anything else that we should be thinking about or talking about in the sort of rehab world? Or anything you want to sort of your chest before I let you escape on a Friday afternoon?
Yeah. I think we could absolutely talk for hours on this, and it's just so great to hear you speak about kind of how important psychology and kind of integrating that into practice is. So yeah, I think there's going to be more and more of these conversations, I'm sure, over the next few months. But yeah, I would encourage anyone that's listening to this that thinks this sounds a bit interesting, to just have a look at the course, see what you think. You know, it's everything emotion management, and it's going to be practically minded, given the context in which you are all working in. So yeah, if you're looking to deepen your understanding those emotional aspects, do have a look at it, come along, or reach out to one of us, and I'm sure we'll have a chat. So yeah, that's
absolutely. Carl, I can't thank you enough for your time Friday afternoon. I really appreciate it. So that was our first Merseyside Health podcast. We're doing sort of coaches and clinicians and fitness experts and stuff. So couldn't have asked for a better guest to kick it off. So I really appreciate that. And we'll speak soon. And I'll see you in April face to face.
Thanks, Ben. Take care.
Brilliant. Thanks so much.
Bye for now.